I'm Madison Mills. This is Bloomberg Quick Take. More than a year after the vaccine was rolled out, new cases of COVID-19 in the U.S. are soaring to the highest levels on record. Here in the U.S., we're averaging over 265,000 cases a day. The omicron-fueled surge is reigniting concerns about our hospital capacity. Here in New York, more than 6,000 people are in the hospital right now with COVID, and that's up 12% in just one day. And while that's far below last year's peak of 19,000, just the sheer number of cases from Omicron could once again overwhelm our healthcare system. So joining us now to discuss is Dr. Dave A. Choksi, Commissioner of the New York City Department of Health and Mental Hygiene. Dr. Choksi, welcome to Quick Take, and thanks so much for your time. I want to jump right in on testing. Obviously, you saw lots of crazy lines heading into the holidays, people traveling. Given the challenges people have had accessing tests, and again, the travel, the gatherings, do we have a clear picture of the status of this virus in New York City right now?
Yes, and look, let me acknowledge we've seen unprecedented demand for testing in the last couple of weeks. And each day we've worked to add more and more testing capacity. We're at about 160 city-run testing sites that will be online by the end of this week. And we are doing more per capita testing than just about any other place in the world. We're doing over 150,000 tests per day in New York City. So we do have to continue ramping up that testing. But with respect to your question about whether we have a good picture of the virus, we do. That gives us, an adequate number for us to be able to tell what the trajectories are. And most important, for people who are testing positive, to take the steps that they need to isolate to help us curb the spread as much as possible.
A lot of the folks like you, public health experts we've had on this show, have said that rapid tests are a big hack to getting through the worst of this. What's the city going to do to dole out rapid tests in the new year?
Yes, this is a major, part of our strategy. We've already brought to bear rapid tests by the hundreds of thousands and soon by the millions in New York City. We use them to meet some of the testing demand that I talked about. And growingly, they will be important for keeping our most important settings safe. For example, using rapid tests to keep kids as well as staff safe in our schools. So this has to be a major part of our pandemic response going forward.
Right. Some of our two big tools here are testing and, of course, vaccinations. I want to talk to you about boosters in particular. Obviously, the 6-month guideline for people getting that booster shot has already passed for a lot of folks in New York City because the city was so great about getting these vaccines rolled out quickly. What are you telling patients who say, hey, my 6-month mark has already passed and I'm freaking out about Omicron?
Yeah, well, I have a simple message. Today is the day to get your booster shot. And certainly for the New Yorkers out there, I want to emphasize how important that is, given the higher level of risk in the community because of transmission of Omicron. In New York City, we've also added a $100 incentive that is available through the end of this year, meaning the end of this week, for people to be further encouraged to get their booster dose. This is particularly important, not just to protect against Omicron, but to help with the most severe outcomes that we want to prevent, such as needing oxygen or a hospital bed or intensive care.
And we're seeing in Israel that they're moving ahead to a 4th booster shot. Where does the city stand on that?
We need to see the science on that. And thus far, it is still very preliminary. So our focus right now remains first on getting anyone who is unvaccinated to get their first doses of the vaccine, because that does continue to confer good protection against severe disease. And then the booster doses for people who are eligible as soon as they are.
I want to talk to you about the unvaccinated population, particularly the individuals who can't get vaccinated even if they want to, the kids in New York City. We're hearing some scary numbers this week that I'm sure you're aware of. The New York State Department of Health warning last week about a disturbing rise in COVID hospitalizations among kids, up 395%, and only 16.5% of New York's kids ages 5 to 11 who can are actually vaccinated right now. How concerned are you about the situation with COVID in children?
Yes, I am following this with some concern, not just as a doctor, but actually as the father of a young child who's not yet eligible to be vaccinated. But it does underscore the importance of vaccination. So actually, it's about 30% of 5 to 11-year-olds who have at least one dose of vaccine right now in New York City. But we need that number to continue to grow because what we're seeing in the hospitalization data is that particularly for the ages that are eligible for vaccination, you're far more likely to be hospitalized if you are unvaccinated compared to those who are vaccinated. And then for those who are not yet eligible, that's where the rest of us come in. We have to take all of the steps that we can, getting vaccinated and getting boosted, and everything else that we can do, like masks, ventilation, testing, to keep our communities overall as protected as possible.
And you mentioned earlier the guidelines coming out as we head into the school year again, January 3rd. Students going back to school in New York City are going to have some new guidelines, including that if they are in contact with someone who tests positive, they're not going to have to isolate right away. They can test negative. If they're asymptomatic, they can continue heading into the classroom. What do you say to the parents, though, who are seeing, again, this surge in cases and they're worried about this being the moment to have a shift in guidelines?
Well, I understand it. And, as a parent, I can say there's just nothing more important to me than the safety and the protection of my own child. But what we are doing is focusing on enhancing safety in schools, which we already know are among the safest places in our communities because the layered prevention approaches that we've brought to bear, like vaccination and masking and ventilation. But the changes that we announced are really focused on further ramping up testing. We're doubling surveillance testing in schools and then bringing to bear in a massive way the rapid tests that will help. At the same time, we are adjusting our quarantine policies because we were seeing a lot of disruption in our schools. So the goal is to identify cases as quickly as possible and get them to isolate while having some more calibrated quarantine policies.
The city was also a trailblazer in the states at putting in vaccine requirements for restaurants, for workplaces. Given the Omicron surge, what is your recommendation on adding a booster requirement to that vaccine check that we're all getting used to at restaurants and bars?
This is something that we're considering, but I'll just go back to what we know about vaccine requirements overall, which is just like vaccines work, vaccine requirements work. That's how we've been able to get to over 72% of all New York City residents, the full population, being fully vaccinated. We're approaching 6 million New Yorkers who are fully vaccinated. And that's because of our vaccine requirements paired with everything that we've done to lower barriers to access and provide incentives and build vaccine confidence. So, it's a really important part of our approach, and it's why people are as protected as they are, which has been so important as we grapple with the Omicron surge.
Are there conversations about the city shifting its definition of fully vaccinated, though, to include a need for that third jab?
Right now, we're focused on getting people who are eligible that third dose. We haven't yet changed the definition of who is fully vaccinated. Instead, we're emphasizing how important that booster dose is for enhanced protection, for further protection. So we will continue to follow the science on this as it evolves, particularly as we understand the importance of booster doses in the context of Omicron. And as we have throughout this pandemic, we have to stay a step ahead of the virus and adjust our approaches based on what we're learning about it.
Well, we're having this chat 2 days before New Year's Eve, obviously a big deal here in New York City and Times Square with Mayor de Blasio tightening up restrictions. We're limiting Times Square and the ball drop to an audience of 15,000. Some people wonder why not cancel the whole thing just to keep everyone safe. What's your response to that?
Yeah, this is something that we've talked about quite a bit, and it's why the safeguards that are in place have been put in place. Specifically, the requirement for people to be fully vaccinated, the much smaller sizes of the groups that will be allowed to gather, the fact that it's fully outdoors, as well as now a mask requirement as well. So as with everything else, we want to layer those precautions. And people, should make their own decisions about higher risk environments over the holidays, particularly anything that is indoors and crowded. If you are at higher risk, or if you live with someone who is older or otherwise at higher risk, like has a weakened immune system, this is a time to be cautious because the risk in our community is higher.
Right. The idea of making your life decisions based on who's highest at risk in your pod, essentially. Really quickly here, what is the biggest goal you have regarding COVID in New York City for 2022? Is it more boosters, more vaccinations as a whole, more testing, more masking?
Well, my fundamental goal is always to save lives and to prevent as much suffering as we possibly can. We're a year into our historic vaccination campaign. I want to redouble those efforts and make sure that we can extend the protection of vaccination as much as possible. And this will help us, get to the other side of the pandemic, because we have a number of other health issues that we need to grapple with as a city as well.
Dr. Choksi, thank you so much for joining us. That was Dr. Dave Choksi, Commissioner of the New York City Department of Health and Mental Hygiene, joining to discuss the city's efforts at containing the surge in COVID we're seeing due to Omicron.